think there was one shift where I had 9 or 10 patients in a row who'd all tried to kill themselves. And that was sort of hit home to me, like, what is going on? And then no one was asking the question to them. It was just a tick box exercise of what the risk was and then go home. But I was just then, what was like, well, why? And on asking the question, they were all saying, well, I haven't got access to help. And I'm on a waiting list for 9, 12 months.
Welcome to the MindTech podcast, where we dive deep into the unsolved problems in mental health with the founders, investors, and experts building technology to solve them. I'm Manu, your host, and in this episode, we dive deep into a startup taking on what the legendary investor Paul Graham would describe as Schlep blindness, which refers to the tendency to overlook significant yet unglamorous problems, Schleps, because they don't offer the immediate gratification of simpler, more straightforward challenges. A popular example of a Schlep problem that has been addressed by a company is online payments, which the company Stripe took on when others found it too daunting. It's often the simplest, most glaring problems that suffer from people turning a blind eye to. In mental health, one of these important yet tedious problems is the long waiting lists for people seeking therapy. Dr. Julian Nesbitt, the founder of the Dr-Julian online healthcare platform, has taken on this problem when many others have shied away from the complexity and systems-wide change that is needed to solve it. Instead of inventing any new way to diagnose or treat mental illness, the Dr-Julian platform simply leverages existing technology to make accessing a therapist more efficient, data-driven, and accessible by making the whole process digital. But the most impressive thing about the Dr-Julian platform is the execution. Dr. Julian has managed to do what so many find difficult to do: penetrate and scale in the NHS, a challenge known to be as hard as moving mountains. In this episode, you'll hear how Dr. Julian presented his platform as a no-brainer for the NHS, where the bottlenecks, often other Schlep problems in mental healthcare, lie, and his thoughts on naming his platform after himself. Listen closely as we dive into the journey of tackling one of mental healthcare's most persistent Schlep problems with the person who dared to look beyond the blindness. Let's get into it. Welcome, Julian. It's an honor to have you here. How are you?
Yes, great. Thank you. Yeah, and thank you for having me here. Lovely to be here.
Wonderful. Well, I'm very excited for this discussion as a fellow clinician to see you take on the entrepreneurial journey and take on the NHS so successfully is really going to be enjoyable for me to hear about, and I very much hope everyone listening gains a lot from it as well. So my first question, just to really understand the why behind all this, is what inspired you to make a mission out of improving mental health?
Yes, it's been a journey for me, I think. Well, sort of 7 years ago now. I think I was an A&E doctor before I became a GP, and I, in A&E you sort of see everything. And I think there was one shift where I had 9 or 10 patients in a row who'd all tried to kill themselves, and that was sort of hit home to me, like, what is going on? And then no one was asking the question to them. It was just a tick box exercise of what the risk was and then go home. But I was just then, what was like, well, why? And on asking the question, they were all saying, well, I haven't got access to help, and I'm on a waiting list for 9, 12 months. We know that we prescribe antidepressants because as GPs, a lot of the time, and I'm guilty of this as a GP myself, we just don't have the time to go into the depth of it, and we just do give antidepressants. Not saying that they're not a great drug, and they do work as well for certain cases, but I think the vast majority of mental health problems, personally, I don't believe should be treated with medication. And I think the way that we can really solve that problem is through therapy and getting someone, changing the mindset. That includes doing all the wellness activities like exercise, etc. But again, that's through changing the mindset with CBT. So then looking at what could truly help them, i.e. that therapy, and looking at the fact that they were on 9, 12-month waiting list, I thought there has to be a better way of getting people support. And then kind of this is, online banking. I was on, you've got your phone there, everything happens, it's consumer focused, you can do everything on your phone. When you look at transport sector with Ubers, etc., it's all consumer focused. In healthcare, we have, we're so behind. And when you look at the systems that we do have in healthcare, they're old fashioned electronic healthcare records that basically just write notes, as compared to having any consumer or patient facing side. So I thought, why don't we use technology to try and help solve that problem? So I thought to myself, if we could build a platform that incorporates and puts the patient at the center of it with this patient facing side, that then can link into a back-end electronic healthcare record case management system, you can sort of join the dots there. But let's put the patient at the forefront, and then let's get the clinicians at the back end. And if we can do it online and do it through telemedicine, for instance, and this was sort of pre-COVID, you could utilize a much wider network of clinicians, I thought. So therefore, you could start to help to deal with that supply and demand issue. And then by having that patient side, you could also give them access to self-help tools, to resources, and the fact that every patient could have their own dashboard would mean that they can have it personalized to them. And then if you could help sort of match them with the right clinician and utilize a global network of clinicians, if possible, but also, just a national network, you can help that supply and demand mismatch better. And then I thought to myself, well, if the clinicians could just put up availability and work from home, you could get extra capacity out of the system. And actually, it's better for the clinician because they have less burnout because they're putting up availability when they want. And therefore, they can have a more flexible living. So I guess that was the sort of idea behind utilizing technology to help smooth out that sort of friction in that care pathway.
It seems like you've really found a bottleneck in mental health services where demand was piling up and supply couldn't keep up, so much so that people were trying to take their own life, right, in A&E. Is this how you view it? Is this how you view your problem that you're solving, really addressing that bottleneck with a much smarter, more efficient, digitized solution?
Yeah, and I think, well, just in general, right, the whole healthcare system is facing a crisis for all sorts of reasons. We're living longer, etc. There's a huge supply and demand problem, and I think we need to utilize technology to try and help solve that. I think the healthcare system in general is not fit for purpose for the modern era. I think it was brilliant for for time gone by, but we're living in a different age now, and we need to catch up. And we've got serious issues with that supply and demand problem. And mental health is obviously the passion of mine through seeing what the problems are in mental health. And I think we just know that it's increasing. And again, there's all sorts of reasons for that, that people talk about in terms of social media, in terms of the fact that we're just bombarded the whole time and our fight and flight response is constantly activated, where, we used to be able to run away from lions, but now we're constantly being pinged all the time. Therefore, this adrenaline response is constantly there. So, there's all sorts of reasons why we're having that problem. Facing the modern era is hard. I think we've lost community. There's a problem with I like to call it relative poverty, i.e. you're always comparing yourself to others, whereas if you were in a group where you weren't seeing people that were better off than you or whatever, then actually you're more content. And I think that contentness is a big problem. So I just think mental health is just going to get worse, unfortunately, and we need to change mindsets. We need to give people the tools and skills in which to deal with their mental health and help them in this modern age, if that makes sense.
Yeah, I think the supply and demand one is a very big problem. And I think it would be quite valuable to get into the nitty and gritty of where exactly are those bottlenecks piling up. I'm sure in your experience as a GP, you get a lot of mental health patients or people presenting with mental health conditions, and you might feel a bottleneck there in primary care piling up, which may well be an entry point for people to access the Dr-Julian app. Where else have you really identified these bottlenecks building up? Where precisely along the mental health patient journey?
Access to therapy, I guess, is probably for me the biggest bottleneck, and that can be through in primary care, but it can also be in secondary care. Now, obviously, we know that in children's services it's even worse, with ridiculous waiting lists like 2 years. So that's a serious problem that needs addressing, which we're moving into. But I think access to therapy. And what happens is you can get an initial assessment quite quickly, actually, and all the stats sometimes sort of tell you, oh yeah, it's a 2 week waiting list. But that's just to sort of have a quick initial assessment. And then what happens is you're then put on 9, what, depending on which area you're in, can be 9 or even more months waiting list to actually get that support. So for me, that's the real bottleneck. And I think then what happens is it falls down to the GP to help deal with that intermediary, and while they're waiting. And I think that's why we prescribe antidepressants sometimes. And I think we don't, we're not trained to provide therapy, and we only have 10 minutes, so you can't really do that, I think. And that's the problem. And then because people don't get help quickly enough, they then deteriorate. So if we were able to provide people help more efficiently and quickly with the right type of help, and the right clinician for them, and then they turn up for that appointment, etc., then we can get people better faster, and then not deteriorating. So I think that was the main bottleneck / challenge that I was seeing, and that's what I'm trying to address and fix.
Yeah, wherever there's a waiting list, there's a bottleneck, right? And the bigger the waiting list, the bigger the bottleneck. Do you see as well patients who are being discharged from inpatient psychiatric services? Do you see them as in need of therapy but needing waiting lists as well? Are you capturing those kind of patients as well as those presenting to GP and A&E?
I mean, yeah, and obviously that sort of much more severe end has also got huge problems because due to supply and demand issues. And I think we are discharging people, and sometimes then they don't have the appropriate support that they might need, or because we just can't give it to them. We just don't have the capacity to give it to them. I'm not.
Mm.
That's not me saying that that people are doing their best and we're doing a great job. But there is, as we know in healthcare, there is a supply and demand problem. So it is tough, and we're not able necessarily to give people the appropriate amount of care, let's say. But everyone is, everyone we know in the NHS is doing an amazing job with the resources that we have. And myself included as a GP, I can't give my patients the time sometimes that they require, which is very depressing, I think. But yeah, in terms of like the really severe end, yes, we do see some, and we do have some step 4, what we call step 4 services. So there are is a stepped care model in mental health. So you have like step 1, which is mainly sort of self-help. Then you have step 2, which is the milder end, which is more, you can do guided self-help there in courses. What happens is you kind of need a clinician, I feel, for people to be accountable to do that self-help properly, unless they're motivated. Unfortunately, a lot of people in mental health aren't motivated. So in that case, they're normally done with what's called a psychological well-being practitioner, and they sort of have 6 sessions. And then you have step 3 care, which is the more moderate to severe end, where you have a course, let's say, of CBT, or a course of counseling, 8 to 12 sessions. And then you have step 4, which is the severe end, as you were saying. Not quite necessarily the psychiatric admission, but yeah, the more severe end. And it depends. We've been focusing online at the moment. So again, to try and utilize that wider network to match people to the right person for them, is better online, because you've got more, you can utilize that much wider network. So, and I think the way we focused mainly is on that step 1, step 2, step 3 care. But there's also step 3 plus, and we do some step 4. Some people in that more severe end aren't appropriate for online, and they do need more specialist help.
Are there therapists looking for work, or is there work looking for therapists?
Yeah, so it's a kind of way of matching it, isn't it? So yes,
Mm.
there are both. Agreed. And that's, I guess, a problem that I'm trying to address with the platform, in terms of matching that up. And I think we are getting more and more therapists coming in, and more therapists can provide if we can provide them flexibility and they can work when they want by using a platform, you get more capacity out of a system. And then if we can
Mm.
use that platform to make them more efficient and help them and automate all their admin, let's get more, let's take away the boring things for them, and let's just get them to focus on what they want to do, which is their therapy, make their lives as easy as possible. Then I think we're able to sort of reduce that clinician burnout as such. So I think that's where technology can really play a part, is as you say, matching that bottleneck up, for
Mm.
those that want work and those looking for work.
And how do you build this network of therapists?
How do you recruit therapy? Yeah, initially phoning people up and talking to them at the very start, and then LinkedIn is helpful, and
Hmm.
then it's mainly around reputation, to be honest. And then therapists talk to each other, and yeah, we've been lucky that therapists really enjoy working on our platform, and we've got quite a good reputation. So we've been lucky. There's been a number of therapists that sort of join us organically. We do some adverts in the Therapist magazine, for instance, and on the website of their regulator, the BABCP, and then and then LinkedIn. But it's been good. We haven't actually had a problem with recruitment, which is great, and we've kind of brought people back in to the NHS that have left. Um, there's a lot of therapists that got so fed up that they've just left and gone working in private services. Some have moved to abroad. We were able to bring therapists back, even working from Spain, etc. In GDPR compliant countries. They can then work back in the NHS by using the platform.
So you found a way to do what is often impossible for healthcare startups, penetrating the NHS. If you could go back to your younger self all those years ago when you were getting started, what steps would you tell yourself to follow to get this done?
Yeah, and it's a journey that you go on, and you sort of have to be very resilient. I think 'cause there's just so many challenges that you just have to keep going, and that's kind of what I did. But the so the way we did it is we provided something that was essential and a real problem. So, i.e., providing therapy was a real issue, and therefore um, the NHS kind of came to us, which was we got our first break, which was great with a small contract slash pilot. The technology was awful, and the way when we start and what we did there was phoning up every patient, every therapist, apologizing, telling them what we're doing, and then giving them understanding. But we're still providing a great service because you've got the therapist providing that service. But then the idea was that over time we can build up the technology around that service. So starting by providing that essential service means that the NHS come to you, and that's how you get in. And then over time, what you can then do is start introducing the technology. And I think a lot of startups will try and just build a technology that is some of it isn't needed, some of it isn't necessarily addressing a problem, some of it is addressing a problem, but it just can't be adopted because everyone is so overwhelmed and it doesn't integrate properly, and just it's people just don't want to have to use another system, essentially. So I think that's where people can fall down. It's better, well, the way that we did it was, as I say, provide a service and then slowly introduce the technology. So by having that core baseline, we're then able to become a tech company from that, but not rely on that tech. And it takes a very long time for technology, for instance, to be adopted in the NHS. And I think long sales cycles, and that's unfortunately what I've seen in a lot of tech startups, where it's just a technology, and you've only got so much runway or runway to go with, and it's just so hard to get it adopted.
Hmm. So really choosing an area that the NHS is massively struggling in panic zone. It's on their priority list, which I know mental health is, and having that strong evidence behind you to show that you can meet their needs, make
Yeah,
yourself seem like you're essential, which is,
correct.
yeah, it sounds like it's just about the only way you can do it. And it's one task to change the way the NHS does something, a huge painstaking task, I'm sure. But how do you engage clinicians? How do you get them to open up themselves to a new way of doing things?
Yeah, and it's interesting. Again, this was sort of pre-COVID, and online therapy was a bit of a niche back then. And I think again, by explaining what you're trying to achieve, the passion, you then get people, the early adopters as such, coming on and doing it, and then they realize, hang on, this is great because I can work from home, I can put up availability when I want, I got a flexible life. And then they start doing it, and they're like, no, this is really I enjoy this, and it makes my life easier. So okay, and then they start, and then people talk to each other, don't they? So again, it's just about people giving that a go, and then finding out if it works for them. And I think it has done. And then obviously COVID came along, and then it was widely recognized as a great way of working. So now everyone's open to it now.
Okay, so I guess what Dr. Julian, the app does is it makes things more efficient and connected rather than introducing a new way of diagnosing or treating, which is why I guess you've been able to avoid the high walls of regulation because you augment what already exists rather than replacing anything.
Yeah.
From your experience so far, have any ideas come to you that you think would actually need regulatory approval, which just make you a little bit excited at the thought of building?
And we're doing that already. So I think so that's a really interesting point. So my philosophy has always been augmentation, not replacement, or replacement potentially in certain areas, but especially for mental health, I believe that we still need the clinician. You can use, for instance, some chatbots in some niche areas. Having said that, that's not to say that won't happen. And it as technology progresses, that may well happen. However, I still believe that the human being sometimes wants to talk to a human being. Um, there are cases, as I say, where some people quite enjoy a chatbot because they haven't got that worry of talking to another human being. But again, it depends on the person and on the scenario. But so yeah, my philosophy will start with and that was because of the current way we're currently working. And I think sometimes if you try and go 10 to 12 steps ahead of the what's happening, again, it doesn't get adopted. So let's replace a therapist. Very hard thing to do. Doesn't get adopted. Whereas my philosophy has been, well, let's go 1 to 2 steps ahead, fit into the current system, but make that current system better. And then slowly we can start to, more slowly we can innovate ahead of the curve from that perspective. And that's, we are going to be using chatbots, etc. But we're doing that in a more gentle way rather than sort of disrupting everything completely. Let's work within the confines of the system and innovate ahead of it, but not totally disrupt it. I think from your question of what we're doing, so I identified a problem, or we identified a problem that patients don't do their homework. Homework is a key part of therapy. Obviously, like if you go to your physio, you only see them for an hour. You don't do your exercises at home, you don't get better. So the reason why people aren't doing their homework necessarily is because they're not engaged, they're not held accountable, because they're sent worksheets on an email and the therapist can't necessarily know if they've done it or whatever. So we've been building out digital therapy homework that will have AI augmentation and assistance in it. So the idea there is that you've got your sort of therapist in your pocket in between sessions doing, and then you and your therapist can set that homework together. Your therapist can see you doing it. The app slash homework product will help you, guide you through it whilst you're not in therapy, but in between sessions, and give you give you that support, and also remind you to do things so at your level, so reminding you to do activities that you've set for yourself with your therapist, and rewarding you, helping you to go through those thought changing processes that you need to, helping you with worry, anxiety in your day-to-day life. So those kind of products we're now building, and again, because we've got the baseline platform, we can now build on top of that as such. But the business is also taking a slight shift as well, in that the platform and technology that we've built as this sort of new model of care is now becoming adopted to augment and then potentially change the way that we deliver in sort of electronic healthcare records. Because again, I feel like electronic healthcare records are outdated at the moment in the NHS, and if we can provide this new model of care with a patient-centric electronic healthcare record, you've got that whole connected care pathway. So we're starting, we've launched our sort of SaaS model, where, because we've built the technology, a number of organizations are now adopting that technology to run their service on, and make their service a much more efficient way of running it.
So how does a patient-centric electronic health record look different to what currently exists?
Yeah. So electronic healthcare records currently are for the clinician to write the notes for the patient. Whereas if you have a patient side to that, so in our system, you've got three sides. You've got the patient side, the clinical side, the clinician side, and then the sort of back end admin, case management, how all the stuff you need to run a service on. So for me, putting the patient first means the patient can do the booking themselves. The patient can actually part write the notes for the clinician, because you can collect all the data that you want from the patient in their patient facing side, and then all of that data that you have can auto populate across the system, so that, for instance, letters, etc., can be just done immediately and instantaneously. It also means that patients can undertake any assessments that they need to do beforehand, before the sessions. So in mental health, we measure outcomes, and we've got great data set. Actually, mental health is probably the best data set in talking therapy services that we have, because we're constantly evidencing it and we're constantly measuring outcomes. So they have to take a depression test, an anxiety test, or different types of tests, assessment questionnaires, depending on what condition they have. So make sure that they're doing that on their patient facing side before the appointment to save time. You can also give them access to self-help tools and resources, having the patient side, and then that can link, as I say, with the clinician side. So it makes the clinician side notes much easier to do. And we've built a system as well that can create unlimited numbers of portals for different services that you can run on them, and then you can customize them fully in a modular way. And you can actually, with a form builder, build your own electronic healthcare record per service that's required, as compared to the old-fashioned system. So I think it's using a modern, in a more modern technology, in a more user-friendly way, and in a more customizable way, which I think needs to happen. But let's put that patient there to really help and augment the clinician. Does that make sense?
Yeah, it definitely makes sense. It's kind of one of those ideas that makes you think, why wasn't that done before? Why wasn't it so patient centric? Because, of course, that's going to improve engagement, assessments, and any interaction, which is what healthcare is for. It's for the patient, right? And improving engagement is going to improve outcomes. And that is the ultimate goal of the system. So I can't wait to see what that looks like. I think the digital homework problem is a big one as well, because as you compared with physiotherapy, most of the work is being done on your own, but the trainer there is giving you guidance and tweaking and telling you what to do, but continuously, not just in those sessions, which is what therapists do as well. And of course, engaging with that homework is difficult for mental health patients. When you're unwell, not very engaged or even able to concentrate, able to be motivated. So how do you improve engagement with digital homework? Do you, of course, digitizing it makes it a little bit more engaging rather than having to print off things? Is there anything that you're thinking about to gamify it, perhaps? And of course, applying data analytics to make sure you give each person what you think they will respond to best is a way of improving engagement. But can you speak to some of these specific approaches you're taking to improve engagement with homework?
Yeah, exactly what you're saying. And I think, I can go into those specifics, but the main thing is actually to test it and evidence it. And I think we're in a fortunate position where, we've got we've got loads of patients coming in that we're treating. So therefore we can run randomized controlled trials quite easily on our platform, to test out different parts of it, and collect that data, work out what type of patient group is responding well to what, etc. So there's a whole data piece there which can really hone that responsiveness. But yeah, essentially, so engagement for me, firstly, it has to be personalized. So it has to be what that individual is going to do. There are tools out there that sort of say you need to go swimming when the person can't swim. So you've got to do that with the patient and the clinician working in a personalized manner, so that they're comfortable with what they're doing. It might be that someone's so depressed they can't get out of bed, so the first goal is to get out of bed, and then reward that behavior to try and gamify it from that perspective. So rewarding, reminding, but not judging and not punishing as such. And then I think key for people doing things, and especially homework, is accountability. So if you know that your therapist is going to watch what you're doing and come and talk you through the homework, you're more likely to do it, as compared to, oh, that therapist isn't going to know if I've done it or not, and I can't be bothered to do it. So you're held accountable, which I think sort of increases your engagement. So you need to be personalized, and you need to be held accountable to it, and then be rewarded and not punished, and reminded and gently guided and helped through, which is the principles that we're using.
Everything you're describing makes me think of what teachers might be thinking of when trying to think of ways to engage their students in a classroom, students of all ages. And they might be thinking, how do we encourage and not put down? How do we, and each person, each student, of course, needs a slightly different approach there, which I'm sure will be refined with your data analytics as well. But are you taking principles from edtech or education in general here to, you know, do what works for children's homework at school and applying that to homework for people when they have therapy?
Well, yeah, I mean, as you said, I think we are. There's probably more that we could look into, but yeah, I'm kind of we just need to test out these principles. But yes, I guess those are the sort of fundamentals, right?
Yeah, it's an interesting parallel. I'm sure there are some things you can transfer there that will really make it even more robust, which is an
Yes.
exciting prospect. Talking about the data analytics, of course, this means you can really tailor your offering to each patient. What qualities or metrics in the therapist do you use in your matchmaking process?
Yeah. So so again, from a data analytics perspective, hopefully over time we can refine that and work out what type of individual might respond well to what type of thing. But a lot of the time when we start, it's around patient choice and understand, for them to form that alliance with that clinician even before they start therapy. And what's happened is by someone helping to choose a clinician themselves, they've already sort of had that bond. And actually, that makes them more engaged. So we have a very low did not attend rate and much higher engagement rates because of that. I think when they're starting out. So patients being able to see the profile picture, read the biography of the clinician, and then help match them, but with filters of the type of issue that clinician might specialize in, which they can do, and then they can also filter by language, and they can see some people want someone of their own background, which again you can do because you've got that wider network, and they can help filter. And then we can suggest clinicians as well based on certain parameters. Obviously, if someone needs CBT, you will show them the CBT clinicians, and they might have a particular problem with anger, and then there are certain therapists that specialize in certain conditions, as I was saying. And then there's also the choice element of the timing of the appointment. So some people can't work, they have to have evenings or weekends or whatever, and therefore you can use filters for timings to find the right clinician for that. And then so there's lots of sort of different parameters that you can use. And the other thing is we let people choose the what medium of appointment, so video voice, like, or telephone, or instant message. Some people like instant message, they want to be seen, they might start with instant message, then they're more comfortable, they move to audio, then they go to video. It just depends on again, giving people choice, putting the patient at the center of it.
Hmm. Yeah, that sounds wonderful. As we gently bring things to a close, a final few questions that I guess zoom out a little bit and take a more lighthearted approach. I found the name of Dr-Julian app really cool. You know how you have taken it from your own, and I wondered what you think the pros and cons are of something like that, because of course it makes it very personal and friendly, the same way many of your patients may like to think of you as Dr. Julian, that friendly face. I can imagine that being one of the things in the pros column. But I wonder, have you thought about the pros and cons of your company being called Dr. Julian?
Yes, all the time, and I'm kind of embarrassed by it. Uh, yeah, the I think again it was chosen because of, and it wasn't actually my decision necessarily to do it. It was chosen from we want to be person centric, and we want it to be clinician sort of, clinician focused, person centric, rather than, there are a lot of generic names out there that don't necessarily mean anything. I think we wanted to put that sort of care at the center of it, from that perspective. So I think, yeah, whether it's more memorable, whether it's more friendly, whether we're more patient centric, and whether it's more sort of um, you know, care, putting care at that center of it, from that. So I think potentially those are the positives. Obviously, the negatives are it's too relatable to a person, which is not true, because it's not me that it's the team that do the amazing work, and it's the company. So we don't want that. Just we don't want it sort of seen as an individual at all, because that's not the way it is. And I guess yeah, it causes controversy. I don't know. Yeah, it's interesting to debate that, and I think, yeah, and we've been thinking long and hard. Do we change the name? But I think at the moment, I don't think so. I think we want to keep that, but so long as we sort of make sure that people don't think of it as an individual, but as a company with those core values at the center of it.
Hmm. I guess it might help in a way to penetrate the NHS, because if you have this platform that's clearly, set up by an NHS doctor, they may well think of you as one of their own a little bit more than just this name, as you say, like a Google or an Apple that clearly doesn't mean anything, but it's like very tech, and it just feels a little bit too outside-ish, compared to this is a name of one of our GPs. This is Dr. Julian setting something up, and if we want innovation to come from anywhere, then why not promote innovation that's come from one of our own, right? So I guess it does help you get a foot in the door there, and perhaps once you have got your foot in every door, which I know you're making your way through, then you may think that at that point there's time for a change, I guess. But at the moment, I feel like it's serving you well.
Yeah, I think. Yeah, I mean, I think again, like having a clinician-led thing is helpful because you understand the problems and you are already in the system, right? And you're sort of there, they're doing. And I think sometimes without the real depth of clinician knowledge in a company or in a tech company, sometimes you're not understanding the real true issues or being able to relate to the people that are working on the front line, if that makes sense. So yeah.
Hmm. Okay, great. Well, I have one final question, and it was going to be, what are you working on that excites you the most right now? But I know you're going to say something to do with that digital homework or electronic health record system, because I know how your eyes lit up when you spoke about it, and it is exciting. So instead, maybe something more interesting would be, what is the biggest obstacle that you're facing right now?
Right. Yeah. I think, well, as I say, from our sort of system led approach, it would be because a lot of organizations are already using a system, and for them to uh, use another system or use a system alongside, it's a big ask and it takes time, and I think you have to do it in steps. So I think that's the biggest problem, right? Is people um, adopting something new because they're overwhelmed as it is. They currently know what's working, and I think for it to be adopted, you have to sort of evidence a step change of 10 times, uh, 10 times better. But I think a lot of people, and the NHS is notorious for this, of being a slow adopter. So it's just going to take a very long time for people to adopt new systems. So I think that's probably the biggest challenge.
Hmm. Well, I very much commend you for taking on such a huge problem, huge system-wide change, supply and demand. It's not a small thing, and I feel like when it comes to tech, it's easy to make something that's very specific and niche, because it's a recent advancement, and applying it to a specific area, you can get a quick sort of you know win. But supply and demand in mental health is just so massive, and it's wonderful to see how much success you've had already. Definitely rooting for you to continue that way. And of course, it's been a pleasure to discuss your journey, all the exciting work that you and your team are doing at Dr-Julian, to making accessing a therapist much more personalized and efficient. So, for everyone listening, how can people support and follow your work?
Yeah, well, no, thank you, man. It's been great to be on here. So yeah, I'm on LinkedIn. So I'll always respond on LinkedIn. So you can find me on there. So that's probably the best way. Yeah, to contact me. So do feel free
Awesome.
to reach out. Mhm.
Yeah, we'll link that in the description. Go check it out. And Julian, it's been a pleasure. Thank you very much.
Thank you, Manny. Thanks.
Every startup that has featured on MindTech is solving a mental health problem with a technology-enabled solution. To get a full picture of all the problems these startups are working on and all the solutions they're offering, sign up to the email list in the description to access the MindTech Matrix. This is the first visual representation of how mental health problems are being matched by innovative solutions. You'll also be updated whenever there's a new episode and get early access to test some of the products that are discussed in the podcast. Everything you need is in the description.